Good morning and welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I am Dr. Linda Snutzelaar, Editor-in-Chief of the journal. And with me today, I have Karen Hawk, who is a PhD student in the School of Public Health Sciences at the University of Waterloo, Canada.
Thanks so much for having me today. I'm really excited to share our research with you and your listeners.
Wonderful, thank you. Today we're going to focus on your article that was titled Body Weight Perceptions Among Youth from 6 Countries and Associations with Social Media Use, Findings from the International Food Policy Study. Why is research particularly on the concept of body dissatisfaction among youth important to study today?
So body dissatisfaction happens when there are differences between how you see yourself and how you want to look, and that can lead to negative thoughts and feelings about your body. And research has shown that regardless of your actual weight, body image perceptions can influence your dietary and lifestyle habits too. So, for example, youth with negative body image may be more likely to try to change their weight by fasting or using diet products or taking laxatives or steroids. And we do want to avoid these unhealthy behaviors in youth and help them feel satisfied with their bodies. I'd say also adolescence is a time when many physical changes to the body occur. So it's an important time for body image to develop. And beyond physical changes, social media has also been found to shape body dissatisfaction in youth because it can lead them to idealize society's beauty standards, which are typically thinness in women and muscularity in men. Also, on a personal level, I do struggle with body dissatisfaction and have struggled with healthy social media use. And I do consider myself a reasonable and mature adult. And I wondered, if I struggle with these challenges, how do younger people deal with them? So I was interested from that perspective as well. And I'm also interested in research that involves different countries because I think you can learn a lot. So, for example, what public health policies are working, what's not working, and how things can be updated to work better. And our study involves 6 different countries. So, I wanted to understand how youth around the world feel about their bodies and the potential differences and the reasons for these differences so that we could identify target areas to better support youth. And unfortunately, we found that youth across all of the countries in our study were struggling with body dissatisfaction. And I think that really highlights the importance of this issue and that we really need to do more to support youth around the world.
Thank you. Such a very important concept, especially as we look at youth. Your study involved a cross-sectional survey. Could you explain how the survey was developed and how you collected the data for your study?
Yeah, so the data were collected as part of the International Food Policy Study, or IFPS Youth Survey. And that's a repeat cross-sectional online survey of youth aged 10 to 17 from 6 different countries. And those countries are Australia, Canada, Chile, Mexico, the United Kingdom, and the United States. And the study involves national surveys that are conducted yearly since 2019, and they're conducted to evaluate the impact of national level food policies. And there's also an adult version of the survey that began in 2017, but we use data from the youth survey from 2019 and 2020, and our final sample size was just over 21,000 youth. To look at body perceptions, we showed participants a series of images that increase in body weight, and we asked them to first pick the image that looked like their body and then the one that they want it to look like. And if they chose the same image, they were classified as satisfied, but if they chose different images, they were dissatisfied. And depending on the different images that they selected, we categorized them as being larger or thinner than ideal. And then we also wanted to look at the severity of dissatisfaction. So we further classified participants as being mildly dissatisfied or moderately to severely dissatisfied, again, for being larger or thinner than ideal. We did also look at associations between dissatisfaction and two measures of social media use. So the first one was screen time, where we asked participants on a normal weekday, how much time they spend on social media. And then the second one was the use of different platforms, which included Facebook, Instagram, Snapchat, and TikTok. So as you can see, there were a lot of elements to this study.
Yes, a beautifully designed study, and thank you for that very detailed description. Your article deals with a very important topic involving, as you have mentioned, body dissatisfaction. How are you defining the term dissatisfaction in this particular article? And can you give us a bit more of detail around how it applies to body image?
Yeah, so body image is a really complex concept, and it involves feelings and perceptions and actions about one's body. A lot of research on body image has focused on body dissatisfaction, which we defined as the difference between perceived and ideal body images. So, what someone thinks they look like versus what they want to look like. There have been other approaches developed to determine body dissatisfaction. So, for example, questionnaires that have asked about satisfaction with one's body parts. There's also behavior measures. So, for example, asking about diet and exercise habits. You can also interview people to ask them directly how they feel about their bodies. And then there's also figural drawing scales. And that's what we used in our study. We used a figural drawing scale that had been validated for adolescents. And as I mentioned, that's the scale that we showed them that shows the series of images that increase in body weight. And then this allowed us to look at body dissatisfaction for being larger or thinner than ideal. And then, as I mentioned, also the severity of dissatisfaction.
Validation is always very important as we look at articles, and that can be a timely process. And so thank you so much for going to the work of actually validating. Thank you. What three things should the reader keep in mind after reading your article?
Yeah, so sorry, just to go back for the previous question, we didn't validate it ourselves. Someone else had done the hard work, and we were just expanding on their work.
Thank you.
So very helpful to look at what other people had done, and grateful for their tools. So
Yes.
yes,
Thank you for that clarification.
yeah, of course. I'm just going to begin by talking about the main findings from our study. So first, we found that dissatisfaction was prevalent across the different countries. So we found that over half of youth were dissatisfied with their bodies. 35% were larger than ideal, and then 20% were thinner than ideal. And there were some very slight differences across countries. We also found that screen time was associated with dissatisfaction. So more screen time was associated with a higher likelihood of feeling larger than ideal. And then we also found that the use of specific platforms was associated with dissatisfaction for different reasons. So, for example, there was greater dissatisfaction for being both larger and thinner than ideal for Snapchat users versus non users. And then also greater dissatisfaction for being larger than ideal for YouTube users versus non users. So, with that said, what can readers identify as important? So first, I think our study highlights the need to promote healthy body image in youth, who often spend many hours every day on different social media platforms. So how can this be done? Well, studies have shown that media literacy programs can help youth understand that online images are often unrealistic. And I think it's also important to note that social media algorithms themselves should also be researched further because they can reinforce body image concerns by showing youth images that may make them feel badly about their bodies. Second, I would say, as we always say, more research is needed. So our study is really just the tip of the iceberg when it comes to research on body dissatisfaction and social media youth, sorry. And we do hope that it will continue the conversation about the importance of this topic. And I think there's still a lot that we can learn about body dissatisfaction. So, for example, research traditionally focuses on women, but our study shows that dissatisfaction is also common in males. I think there needs to be more research on gender minority youth. So, for example, transgender individuals, because they do experience body dissatisfaction. And I think more research also involving different ethnicities can also be done in the future. And I'd say when it comes to social media, researchers should be aware that it's not only the time that's spent on social media that's important, but the platform too, because that can impact what people do or what they see online. Third would be the importance of language. So we found that youth who experience weight-based teasing were more likely to report body dissatisfaction than those who had never experienced this form of teasing. So I think it's important to encourage parents as well as siblings and friends and teachers and really anyone who works with kids to really watch their language when they're working with youth to avoid teasing language. And if I can add a fourth, I would say it's important to also spend less time on social media because we found that more time online was associated with body dissatisfaction. So I think youth can benefit from putting down their phones, especially if they spend time on image-based platforms like YouTube and Snapchat. And I think that can be something that parents may be helpful to encourage. And I know the weather here in Canada is getting a bit colder, but I think taking a break from social media, going for a walk, playing outside, or picking up a new hobby would be great alternatives.
Such important information from your study. How might the practicing RDN use your study results in their clinical settings?
Yeah, I think that's a really great question to get some practical tips. And I would say, as we mentioned, we found that weight-based teasing was associated with body dissatisfaction. So I think dietitians can really watch their language when they're working with youth and their families and encourage families to use positive and non-teasing language. I think dietitians can also ask how youth are using social media and who they follow. So, for example, they can suggest some body positivity bloggers to follow, or also credible dietitians or other healthcare practitioners, because I think there can be some people online that may make claims that may not be based on reliable evidence. I think they can reinforce messages that online images are often unrealistic and encourage youth to spend less time online. And I think it's also important that they encourage youth to live healthy lifestyles that include healthy eating and exercise, and also to deter unhealthy weight control behaviors like taking diet pills or laxatives. And speaking as someone who isn't a dietitian myself, I do hope these tips are useful. And I would say if anyone listening has other ideas, it'd be great to connect and just learn more about your experiences and different ways that you would like to use this information.
Thank you so much, Karen. And then finally, do you have any closing messages for this audience?
Yeah, I think overall, I think we need a cultural shift on really what it means to be beautiful and to really think about the types of bodies that we want to have and why. I think the online body positivity trend is really encouraging to show that people can be happy and healthy in different sizes. But I think really our research shows that more needs to be done to support youth in feeling satisfied about their bodies. And I think it'll take time and I think it'll take a coordinated effort from different stakeholders, for example, the media and government, in order to make this shift. But I think if we can change our thinking away from what we look like in the mirror or on the scale or compared to those around us, and focus instead on living a healthy and active lifestyle and putting more value into things like our work and our school and our family, I think we'd be happier with our bodies and just happier with ourselves in general. And I think that would be really nice.
Thank you so very much, Karen. I know that some of these details that you've provided today, such beautifully thought out concepts, will be very important to listeners. And I wanted to say too that I wish you the very best as you work on your PhD. And possibly in the future, I will be introducing you as doctor.
Thank you.
And thank you so much for giving me some of your time today to do this particular podcast.
Oh, no, thank you so much. It's really great to be able to share our research, and I hope everyone listening finds it really interesting and helpful. And as I said, great to keep in touch and look forward to comments from other researchers and everyone else listening. Thank you.